Have you been injured in a car accident recently? My name is Dr. Leo Boisvert. I've been in practice for coming up on my 30th year, and I practice here on Nicholasville Road in Lexington. Top three reasons why you would want to get evaluated quickly after a car accident. Number one, you have a chemical release at the time of impact. In fact, various chemicals that cover pain. So you might be thinking at the scene, I'm okay, no big problem. I think I'll be fine. And you might even make that statement to the other driver or to police. But give it 24 hours, you might start really feeling some aches or pains, and you want to be evaluated by a place for a reasonable amount of money. That's my emergency room. It could cost you $2,500, $5,000 in 15 minutes time. You may not need all that diagnostic work done. So, number one reason, reasonable and prompt service. Number two, I'm a chiropractor, been doing this, like I said, for coming up on 30 years. But manipulation to the neck, particularly right after a motor vehicle collision, is not necessarily what you need. You probably need some mobilization, some real gentle figure eight type stuff, not a big crack pop to the neck, at least not in the beginning. You may not need it at all. If you had a disc injury, you might want to utilize non-surgical spinal decompression here in our office, which is now covered by Kentucky personal injury carriers. So those are good reasons. And then the third reason is, if you let time pass, abnormalities, positions, bones out of position, bones that are stuck and jammed, they kind of get used to that. You don't want them to get used to it. You want them to be put back where they belong and begin moving again a reasonably quick amount of time. Fourth reason why you might, this is the bonus reason, if you let 3 or 4 or 5 or 6 or 7 weeks go by before you decide to do something about that pain that just won't go away, well, imagine your State Farm or your Progressive or your Farm Bureau or whoever your carrier is. It's not unreasonable for them to think the question or the thought, I wonder if the reason for the 6-week delay is that it didn't really happen in the car. You know, there's people that would do that. You wouldn't do that, but you need to report that accident and then get evaluated by a licensed healthcare professional quickly, within a reasonable amount of time, so that it's clear that the injuries you sustained in the car are exactly what you're presenting for here today.